Hey everyone, Dr. Mike here. Taking care of our teeth is important for overall health, and that starts from a very young age. As a doctor, but more importantly as a dad, I know how much you want to give your little ones the best start in life. Today we're going to talk about how to develop healthy oral habits for your kids from infancy to early childhood. We'll cover everything from teething to brushing, and even how diet plays a role in those pearly whites. Remember, taking care of those baby teeth is crucial, even though they'll eventually fall out. They act as placeholders for adult teeth and contribute to proper speech development and chewing. So, let's get started. Teething, that exciting yet sometimes challenging milestone that all babies go through. It's a significant part of their development, marking the beginning of their journey towards a full set of teeth. You might notice your little one getting fussy, drooling more than usual. Seriously, it's like a waterfall sometimes, and even gnawing on everything in sight. These are all common signs that your baby is starting to teeth. You can usually expect the first tooth to make an appearance around 6 months old, but every baby is different. Some babies might get their first tooth as early as 4 months, while others might not see that first pearly white until they're closer to a year old. Some might start teething earlier, some later. It's totally normal. Each baby follows their own unique timeline, and there's a wide range of what's considered normal. By the time they're 3 years old, they'll usually have a full set of 20 baby teeth. These primary teeth are crucial for their development, helping them chew food properly and speak clearly. Now, when those little teeth start pushing through the gums, it can cause some discomfort. This discomfort can vary from baby to baby, with some experiencing more pain than others. A classic sign is your baby wanting to chew on everything, which is their way of relieving the pressure. Chewing helps to massage the gums and can provide a bit of relief from the pain. To help soothe your teething baby, try offering them a clean teething ring or a cold washcloth that's been chilled in the refrigerator. The coolness can be very soothing for their sore gums. The coolness can help numb the gums, providing temporary relief from the discomfort. It's a simple yet effective way to help your baby feel better. Gently massaging your baby's gums with a clean finger can also provide some relief. This can be especially helpful if your baby is having a particularly tough time with teething. If your baby seems particularly uncomfortable, you can always check with your pediatrician about using an over-the-counter teething gel. These gels can provide additional relief, but it's important to use them as directed. Remember, teething is a natural process, and with a little patience and these soothing techniques, you can help your little one get through it comfortably. It's all part of their growth and development, and soon enough, those tiny teeth will be a source of pride for both you and your baby. Even before those first teeth pop through, it's essential to start good oral hygiene habits. This might seem like a small step, but it lays the foundation for a lifetime of healthy teeth and gums. I know, it might seem strange to clean a baby's mouth before they even have teeth, but trust me, it makes a difference. Early oral care can prevent future dental issues and helps your baby get used to the routine. After feedings, gently wipe your baby's gums with a clean, damp washcloth or gauze pad. This simple action helps to remove milk residue and bacteria that can build up in their mouth. This helps remove milk residue and bacteria, setting the stage for healthy teeth later on. It's a small step that can make a big difference in your baby's oral health. Once that first tooth emerges, it's time to introduce a soft, bristled infant toothbrush. This is an exciting milestone in your baby's development. Look for one with a small head and a large handle that's easy for you to grip. The right toothbrush can make the process easier and more comfortable for both you and your baby. For now, just use water on the toothbrush. There's no need to introduce toothpaste just yet. You don't need toothpaste yet, especially not fluoride toothpaste unless your dentist recommends it. Fluoride can be harmful if swallowed in large amounts. And babies tend to swallow a lot when they're first learning to brush. It's important to be cautious and follow your dentist's advice. Brush your baby's teeth twice a day, once in the morning and once before bedtime. Establishing this routine early on helps your baby get used to the process. Make it a fun experience by singing songs or letting them hold a toy. This can make brushing time enjoyable and something your baby looks forward to. The key is to establish a routine early on. Consistency is crucial in helping your baby develop good oral hygiene habits that will last a lifetime. Let's talk about bottles and pacifiers, those little tools that can be lifesavers for both parents and babies. We all know how helpful they can be in soothing a fussy baby or helping them fall asleep. But it's also important to be mindful of their potential impact on oral health, especially as your baby grows and develops. Try to avoid putting your baby to bed with a bottle filled with milk, formula, or juice. While it might seem like a good idea to help them sleep, it can actually cause more harm than good. The sugars in these liquids can linger in their mouth overnight, increasing the risk of cavities and other dental issues. It's best to stick to water if they need a bottle at bedtime. If your baby needs something to suck on for comfort, offer them a pacifier instead. Pacifiers can be a great alternative to bottles when it comes to soothing your baby. Just make sure it's a clean one. Regularly cleaning pacifiers is crucial to prevent the buildup of germs and bacteria. Speaking of pacifiers, it's a good idea to start weaning your child off of them by age 2 or 3. This can help prevent any long-term dental issues. Prolonged pacifier use can affect the shape of their developing palate and lead to misaligned teeth, which might require orthodontic treatment later on. The same goes for thumb sucking. While it's a natural reflex for babies, it can cause similar dental problems if it continues for too long. If you notice your child is still sucking their thumb beyond the age of 4, talk to your dentist about ways to help them break the habit. They can offer strategies and support to make the transition easier. Remember, these are just general guidelines. Every child is unique and may have different needs when it comes to their oral health. Every child is different, so it's always best to consult with your pediatrician or dentist for personalized advice. They can provide tailored recommendations based on your child's specific situation and needs. We all know that sugary treats can be bad for our teeth, and it's no different for kids. In fact, their baby teeth are even more susceptible to decay. Limit sugary drinks like soda and juice, which can erode enamel and lead to cavities. Water and milk are the best choices for thirsty toddlers. When it comes to snacks, opt for tooth-friendly options like fruits, vegetables, cheese, and yogurt. These foods are not only nutritious, but also help promote saliva production, which naturally cleanses the mouth. If your child does indulge in sugary treats, make sure they brush their teeth afterward. And remember, moderation is key. Teaching your kids about healthy eating habits from a young age will not only benefit their oral health, but their overall well-being too. So there you have it, folks. We've covered the basics of establishing healthy oral habits for your little ones, from those first toothless smiles to those pearly white grins. Remember, early intervention is key when it comes to oral health. By starting good habits early on, you're setting your kids up for a lifetime of healthy smiles. And trust me, as a doctor and a dad, there's nothing more rewarding than seeing those happy, healthy smiles. Don't forget to like this video if you found it helpful, and subscribe to Tranquility TV for more parenting tips and tricks. Until next time, stay healthy.